So right now, Grace, can you see me on the camera?
Yes, we are live, Dr. V.
Oh, awesome.
We are live, and welcome everyone to the Carnosine Q A with Dr. V. You're watching this across multiple platforms. So if you're here from YouTube, Instagram, or Facebook, please let us know where you're tuning in from. This is going to be a fast-paced, interactive Q&A with our Carnosine expert, Dr. Willie Villareal. My name is Grace Leary. I'm a mum of 5, and I am so excited about learning more about carnosine because it's helping me on the daily. Please let us know where you're tuning in from. Dr. V, you're in Houston.
Yes, ma'am.
Dr. V has a wonderful clinic, and he is a leading longevity expert. But I'm just going to let you guys know that are tuning in live. This series is for educational purposes only. So we will not be diagnosing or treating any medical illnesses. Please consult with your medical professional before trying anything. Dr. Villareal is a longevity medicine expert, and he helps his clients at his Houston clinic reach their highest potential through cutting-edge personalized medicine. And Lactigo is in your arsenal, isn't it, Dr. V?
Every day now.
So we've been hearing wonderful things on our educational series. I'd love for you to tell us a little bit about Lactigo, this amazing gel that everyone is getting so excited about. We've got questions coming in already from YouTube and Instagram. So could you just introduce us to this wonderful gel? And I'm going to fire some questions at you that people are asking.
Cool. Awesome. Well, just at its basic level, carnosine is something that was very prevalent in our tissues when we were younger, up until teenage, 20 years. And then at 20 years old, it starts to rapidly decline. It's kind of concentrated in our muscle tissue, in our heart and our brain. And the biggest issue that we've had in the past with carnosine is it very, very, very difficult to get into the tissues orally. We have something called carnosinase, which is an enzyme that tends to break it down actually very, very, very quickly. So it lasts a very short time in your serum. And so taking an oral carnosine, or the only other way that we were able to get it is by oral beta-alanine supplementation. So just didn't really work. And to take beta-alanine, you had to take a lot of beta-alanine, about 2 to 6 grams a day, which is about 2,000 to 6,000 milligrams to hit muscle tissue saturation after a few weeks to months. And the problem with that is that very commonly, a very common side effect that you would see with oral carnosine or beta-alanine is paresthesia. So if anybody's ever taken a pre-workout with a lot of beta-alanine, you get those beta-alanine tingles. Those are paresthesias. And so it's very, very common when you're doing high doses of carnosine. But carnosine at its essence is just an amino acid. It's a dipeptide of L-histidine and beta-alanine. And it's naturally occurring, like our cells make it. The problem is that as we get older, we age. And one of the main causes of aging that we have seen is actually the drop in the carnosine. And study after study after study, I mean, you can look it up on your own, verifies that carnosine does a whole host of things to prevent aging and to kind of combat that. So one of the main ways that it does it is by actually buffering something called AGEs, or advanced glycation end products. AGEs are what are primarily responsible for easy what you can remember as aging, AGEs. So what that comes from generally is our diets. We tend to have, unfortunately, across the world, a very high sugar diet. And what that leads to is a lot of inflammation, production of what we call ROS, or reactive oxidative species, and things like that. But overall, it just helps in got a ton of different ways. So been well known for a long time in the sports and performance world, because the main thing that carnosine was known to do was buffer lactic acid, which is why like our product is called Lactigo. The amazing benefit of Lactigo versus oral carnosine or beta alanine or any of the other types of supplementation that we've seen from the past is it bypasses that whole oral pathway. So it doesn't get broken down very quickly by what we call carnosinase or CN1. And so it goes directly to the target tissue, and it completely bypasses that. So the interesting thing is that carnosinase, that enzyme that breaks down, that's in our bloodstream, is very, 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 very prevalent. CN1 is very, very, very prevalent in our serum, but you find little to none of it in skin, in our interstitial tissues, our muscles, our ligaments. So that is why Lactigo has been showing so many great benefits, is because it completely bypasses that, doesn't get broken down, and then it's able to hit our target tissues and exert the effects that we need. So that's kind of the basis of it. We could go deep in the weeds. I want to keep it kind of functional for everybody and understandable.
Amazing.
Is there any specific questions that
yeah, we've had lots rolling in already.
Okay.
And a lot of them really are about that longevity, because I think that's the key that everyone wants. But we've got people over from YouTube. Hello to everyone. People tuning in from Nicaragua, on Instagram, South America. We've got someone from Missouri, Louisiana, Australia. This is amazing. It's so great that we can be live and share this education around this incredible molecule. We've had a question come in here from P. Maria on YouTube. How does it compare to MAP?
MAP.
Would you be able to clarify that, Maria? Okay, we'll move on to another question while we hear back from Maria. So we've had a question in about vegans. So that carnosine can be referred to as the meat molecule. I don't actually know about this. So can vegans still benefit from the longevity benefits that you were just discussing?
Actually, they probably benefit the most, because they get zero in their diet, if they're, depending on how strict they are, right? So depending on how strict they are, they will get very little to no carnosine in their diet, because they're not eating any type of meat. And it just depends, what type of vegetarian or are they, lacto. There's so many different, designations, but the thing about it is that like, if you look at the uptake in the diet, they will probably benefit the single most, because they don't get it in their diet. Whether, like, as omnivores, we tend to get about 50 to 250 milligrams a day of carnosine. Pescatarians, chicken, people eat chicken by 10 to 50. When you start getting into the lacto, ovo, vegetarian, like less than 5 milligrams a day, and then strict vegans are like basically zero. So they would benefit greatly, because, a lot of, and this has been studied, so it's not just me saying, hey, I prefer, there's meta-analysis studies, recent meta-analysis studies from like 2020 to 2025. They show that like vegans have like about a 50 to 80% lower muscle carnosine, and chronically higher circulating what we call AGE precursors, and going back to the AGEs. So what's relevant for longevity for them, or the consequence for vegans, is basically they're going to have faster accumulation of those AGEs, which means they're going to have stiffer arteries, skin, lenses, the wrinkling of the skin, stiffer lenses, so cataracts, kidney function, accelerated brain AGE pathology, like Alzheimer's risks, and slightly faster loss of muscle quality with age. We're going to fight that anyway, like with age-related sarcopenia, and we see that more prevalently in like the vegan and vegetarian community. So yeah, I mean, there's a lot of longevity benefits. Again, going back to the AGEs, because, you know, that's what's going to age you is you know, preventing that buildup of the AGEs.
Okay. So vegans and vegetarians need more carnosine. And is a way.
It's an amino acid. So that's one of the big pushbacks from a lot of vegans. And they say, well, we can get just as much amino acid profile as like meat eaters or omnivores. Yes and no. They get it in different amounts, right? So like, you know, somebody that has animal-based protein are, you know, they're very high in certain amino acids like leucine, which is important for like muscle building. And, you know, they're very, but like, you know, vegans, they have like their leucine intake is very, very low. So the amino acids are in there. They're just not in the right proportions, but they're, like I said, like it's been studied in vegans and vegetarians, they have very, very low to no like carnosine in their muscle tissues.
Okay, so how would a vegan or vegetarian use Lactigo to increase their carnosine?
Just topically twice daily, or the sweet spot really 3 times daily is what we've heard from a lot of patients. But minimum is twice a day, AM, PM, topically. And specifically, it's preferential, you know, larger bodies of area, your legs, your quads, whatever's easier to reach, your shoulders. But, you know, especially if they have any kind of like pain, areas of pain or injury, I mean, we say put it where it hurts.
Yep. Okay. So the question Paula asked before about MAP, master amino protein. So does it differentiate?
A proprietary blend of essential amino acids designed to, okay. So I guess she's talking about a specific, so the proprietary blend, proprietary anything is like, they don't tell you what's actually in it. It's proprietary, right? So I don't like proprietary blends of any kind, simply because there's not full disclosure of what's exactly in it. So as far as master amino protein, like I'm not familiar with that. You know, so again, this is very different. And again, here's the thing is, going back to it, how is it different? I'll tell you flat out, you're not going to get oral carnosine or beta alanine unless you're taking large amounts of it. You're not going to get muscle tissue saturation of carnosine in your muscles unless you're taking high doses specifically of beta alanine. Okay. Historically, that's how it's been actually supplemented, was high doses. Like I said, 2 to 6 grams, 2,000 to 6,000 milligrams for a long period of time. In something like that master amino, you know, a protein, I mean, it's yeah, essential amino acids are awesome. Like, I mean, I recommend them to every single patient as just building blocks, but there's no comparison. This is a very specific, unique, and the product itself, the delivery system is what makes it work. That master amino protein, if it's an oral supplement, you're going to run into the same, you know, first pass gut issues that you're going to run into with everything. The thing that makes Lactigo unique versus anything I've ever seen, or anything pretty much anybody's ever seen, is the delivery system and how it goes directly transdermally into the tissue. And it delivers, you know, 100% muscle tissue saturation in about 30 to 45 minutes. So yeah, they're not, I mean, it might be a really, really great product. I'm not familiar with it, but again, orally, it's going to have the same, you know, downsides as you know, just supplementing beta alanine or histidine. So
okay, thank you. We have a question from over on YouTube from Minimalized. Have you had any success in using Lactigo with frozen shoulder to reduce pain?
Yes, especially when used with a really good practitioner that does, say, like Graston, any kind of ART or active release treatment, in conjunction with like any kind of micro needling. But the results that we have seen itself, and again, we try not to get carried away. We've had a lot of people say, hey, I know y'all are really excited about it. You got to just be real careful about saying how quickly it works. I was just at a dinner and, with Bill Starkey and a couple other people. And again, it was the same story over and over. The two guys that were at the dinner, like he said, I put it on my wife, like within 5 to 10 minutes, she had no pain anymore, no back pain, no shoulder pain. But frozen shoulder, that's a difficult one. That's not something that, you're not going to slap Lactigo on it and it's going to go away. Now it'll start addressing the inflammation, the inflammatory pathways. It reduces what we call TNF, tumor necrosis factor, and like some inflammatory markers like IL-6. There's a lot of studies showing how it reduces specifically like inflammation markers. But as far as like a frozen shoulder, that's going to take time. That's going to take a really good practitioner that knows how to, probably a sports chiropractor, somebody that knows how to really do like a lot of ART, like Graston and ART, like fascial release. But yeah, it would be an amazing conjuncture. But we've had a lot of good people, not specifically with frozen shoulder yet, but any kind of shoulder injury, any kind of shoulder pain, people that have not been able to do any kind of overhead work for a very long time, all of a sudden literally put it on one time and say, I don't know. They all say the same thing. Like, I don't know if this is placebo or not, but I haven't been able to do this in months. So it literally works very, very, very quickly. Now, frozen shoulder probably could take a little bit longer.
Okay, so that's just coming from Instagram. Is the Lactigo masking pain?
No. It's working literally at the cellular level. Like I said, there's a lot of studies on how it reduces inflammatory pathways. And one of the main ways it works, it reduces a specific inflammasome called NLRP3. And if you think about like the inflammatory cascade, like a domino effect, NLRP3 is a kind of that first domino that it doesn't let it get tripped. That way you don't get that inflammatory process, continue down the road. So no, it doesn't mask pain. It's not a pain gel, but interestingly enough, like when people use it, it relieves pain. So we tell people flat out, like, it's not for pain, but it relieves pain. So we can't really call it a pain cream, but again, the things that we've seen are amazing. And that's why like the hashtag is like, just try it, because we can talk about the science but until people actually try it and actually believe it and see it with their own eyes, there's been nothing like it that I've seen in practice in years.
Amazing. So we've got lots of questions over on Facebook. We're going to get to your questions very shortly, guys. There's a few questions on different platforms around pregnancy. So I can share myself postpartum. I have used Lactigo on my stomach, around my womb, and my goodness, my healing. I had a baby 3 months ago and it was incredible. I know there's someone else that has mentioned on here that it's helped with mastitis. And someone here, Brent Lee, is asking a question about using during pregnancy for morning sickness. So there's a few different things around pregnancy there. Would you be able to comment on any of those?
Specifically
around just recovery. So why did my womb recover and come back together quicker than in the 5th pregnancy than any others?
Well, again, going back to the healing factor. So again, if you look at the specific studies on it, one of the key inflammation markers that, we look at is like C-reactive protein or CRP. I mean, studies have been shown like carnosine itself actually reduces it by like 20 to 50%. And so when you get a product that can actually deliver it directly to the target tissue and have it exert its effects on that target tissue rather than waiting on this oral supplementation. And here's the deal. Orally, it doesn't matter how good the cellular absorption, how good the product is, how good anything is. Nothing is going to beat the first pass gut, avoidance that the topical Lactigo does. Now, going back to you again, like if it speeds up healing, like I said, in not just not just muscle tears. Like I got that question earlier about muscle tears, but again, like you could go on and on and on, but specifically because of the reduction in the TNF alpha and the IL-6 and the CRP, basically with your pregnancy, you have a stretching of, you have damaged muscle tissue, and it's just going to help. There's strong multiple, RCTs or, studies showing, the anti-inflammatory effects of the of carnosine itself. So, I'm reading some of the comments, and it says like Dr. Luca Moretti, scientist on MAP, check him out, bypasses organs, hits bloodstream. Yeah, bypasses organs, but it's still, if it's oral, it still has to go through the gut. Anything that goes through first pass gut is gonna be depleted in some way, shape, or form, and Lactigo bypasses all of that and just goes right to the target tissue.
Okay, amazing. That shoulder pain as well from breastfeeding on this area here, absolutely incredible. Just for pregnant and breastfeeding mothers, is Lactigo safe to consume? Can you have too much of it? For anyone, really?
Yeah, the beauty of it from a medical standpoint, what I love about it as a practitioner, I don't have to worry about interactions. Okay, I don't have to worry about, it's an amino acid. You can't overdose on it. There's no contraindications. There is no medical interactions. I don't have to worry about, worrying if a patient is on a medication that it's going to interact with. It is safe. And whenever I look at any kind of therapy, any kind of new peptide or any new kind of hormone therapy, it's just, you always look at the risk benefit ratio. And the risk benefit is, with Lactigo, the benefit is very, very high. And there's, in my eyes, and what I've seen is there's no risk. Now, as far as like ingestion, I mean, if you're going to use it for like, say, mastitis or any kind of like, issues with breastfeeding, I mean, obviously you want to clean the area. I mean, it's not for oral intake. It's literally topical, but you just have to make sure that it's real clean. It's not toxic. It's just like it's just magnesium and carnosine. But yeah, any type of inflammatory process, any kind of itis, any itis, it will help with.
Okay, so speaking of the itises, we've got a question over on Instagram. How can it help rheumatoid arthritis? Again,
going back to the inflammation. Now, it's not most likely going to affect, say, the rheumatoid factor, the actual antibodies. But as far as the pain, the inflammation, the flares that rheumatoid can cause, that is definitely, and we've had a number of patients. Initially what was really crazy is that I kind of sequestered it over to, it's going to be for my athletes, and and it works. I mean, the athletes, hands down, it works. What I've seen the majority of people helped with is you're just 40 to 50-year-old people that go to bed fine, and you wake up like a truck ran you over for no reason. You wake up sore, you wake up hurt, you wake up, and that's anybody over 40, 50. It doesn't matter if you're training, if you're in shape, not in shape. Everybody over 40 to 50 is going to have some type of joint pain, inflammation, a tweak. And I haven't seen a condition yet that it has not helped with. Okay. Period.
Amazing. We're having some great feedback here. Carnosine is for everyone. It has helped my husband tremendously with his shoulder and me with my hip pain. And Minimalize has said she's used it on a client, just one sachet. So is when we talk about use here, yes, are people feeling it from one application? And then what do you recommend long term?
Yeah, so the one application generally works, but again, it goes back to the pathology, right? Like the question earlier on the frozen shoulder, that's going to take some time. I mean, frozen shoulder, like we sometimes have to take people into surgery, put them to sleep to kind of break up, depending on how frozen it is, break up that scar tissue. And it's a nasty sound. If you've ever been in one of those or seen a video, I mean, it's a nasty sound. I used to do a lot of sports medicine, orthopedic surgery, and it's a nasty sound. So that probably will take a lot longer, but one application, we've seen it like work immediately within 5 minutes. with people, and that's the prevailing theme is like 5 to 10 minutes. I have a very close doctor friend who I've mentioned before that went to one of our first, conferences, our first talks, and his feedback was, hey, he said, man, you got to be real careful about how, talking about the magical gel and how quickly it works. And I said, no, I get it. He goes, you're gonna give people, too good to be true vibes. And I said, I get it. I said, but I'm just reporting what we're seeing. Well, he had one of those effects, and then he reached out a couple of days later, and he said, "Hey, I just didn't tell you that I was really hurt, and I put it on my knee after the conference, and all of a sudden it healed my knee." And so, he had hurt his knee moving some furniture. He's 74, and he reached out a couple of days later and said, "I take back what I said. It actually did work as fast as you said it was going to work." So yeah, I mean, ideally, some situations may take a little bit longer, but again, 1 to 2 applications daily minimum. The more, the better. You can't overdose on it. You can't put too much. There's no upper limit. So the more, but initially, say like in an acute injury, acute pain, you may want to use it, 1 to 3 times a day minimum,
Okay.
multiple times.
Okay. So over on Facebook,
Mm-hmm.
getting to there now. So we've had a couple of questions come in about diabetes, people suffering with diabetes.
Mm-hmm.
Can carnosine help with common diabetic complications,
Yes.
specifically nerve damage?
Yes. And a lot of the biggest body of work, if you look at a lot of the studies, have been done specifically on metabolic issues like pre-diabetes, type 2 diabetes. There are a ton of studies on it. Okay. And again, going back to the effectiveness of how well it works against or prevents the advanced glycation end products. When you look, those are directly coming from the high sugar in the diet or the high sugar in the tissues. The AGEs are going to, like, again, going back to that, it's going to stiffen tissues. It's going to inflame vessels. It's going to accelerate complications like neuropathies, retinopathies. Again, with diabetes, like those are the things that we work with, or you see secondary, but there's studies on it lowering fasting blood glucose. There's studies on it in specifically with hemoglobin A1Cs. There's like multiple meta-analysis showing where it helps to stabilize like long-term control of the A1C, equivalent to about 3 to 6 months of lifestyle changes, like especially in early type 2 diabetes. There's studies on it reducing what we call postprandial glucose, and it insulin sensitivity. We run specific labs called HOMA-IRs to kind of look at somebody's insulin sensitivity or insulin resistance. And I mean, unfortunately, a big majority of the patients that I see coming in, they're coming to see me a lot of times for hormone replacement or kind of menopausal control for women and things like that. But about 50% of them coming in are metabolically compromised. They're either borderline pre-diabetic, already pre-diabetic. Some come in full-blown diabetic and they have no clue. And I'm using it with every single one of those patients now because it's a very safe adjunct. Okay, it's a very, very safe thing to add. It's just topical, and mechanistically, the studies are there. So why wouldn't I try something that has no downside, massive upside, and also can help prevent a lot of the complications that you see with long-term type. A lot of times they come in and they've had pre-diabetes for over 10 years. And, I'll say, hey, does anybody told you have pre-diabetes? They go, oh yeah, my primary care's been telling me that for years. And I'm like, and they haven't done anything about it. They just don't have unfortunately, the primary cares, they don't have the tools beyond, medication. And medications can really, really, really work. But when your only tool in your toolbox is medication to treat a disease that is primarily lifestyle and caused by diet, and not address the diet and lifestyle, like that's not proper practice. And so it is just an amazing adjunct to help with blood sugar control, improving the tissues, working against the neuropathies, the risk of retinopathy, which is why they get annual eye checks and annual retinal checks. But again, if you look at what is the primary root cause, it's going to be that increase in advanced glycation end products from the high sugars in the tissues and the diet.
Okay, amazing. Well, this has been an incredible information education session. Everyone in the chat absolutely agrees. They're saying, thank you, Dr. Villareal. We can't wait to do this again. But we're going to have to stop now. We do have more questions that we haven't had answered. So we're taking note of all these questions and we will get back to them. But I just wanted to say thank you so much for coming on and sharing your expertise. We've got more great comments rolling in here still. Wow, wow, wow. Thank you for your time. Thank you for everyone that has jumped on here. Next week, as we continue this education series about carnosine, we are going to talk about the origin of the science. We've got NHL Stanley Cup champion Eric Fair and the founder Kevin Atkinson. They're going to be telling the story of how Lactigo came about and how this carnosine delivery system was found. We're also going to have the fitness guru, Chris Tarver. So that is this time next week. We will be streaming live across all platforms again for the Carnosine Conversation series. Thank you so much, Dr. Villareal. We just appreciate you so much leading the way. As here having this conversation on the planet, we're in the first of really putting carnosine in the forefront and the limelight like it deserves to be for the miracle molecule that it is. So thank you to everyone joining us live. And thanks again to Villareal.
Last little comment. Y'all have no idea what's coming down the pike. This is just kind of the flagship. And a lot of the things that are coming is just gonna keep improving and exploding. So there's some amazing things coming down the road.
Oh, we'll leave you with that. Everyone wants more. Thank you so much, and we'll see you next time.
Good night. Take care.